Hi everybody, Dave Eling. Welcome back to another segment, second segment of Veterans Did You Know? Today we're at Hospice, the Mercy Visiting Nurses Services and Hospice Services, and I'm with Moni Franks, who's the director here. And we were talking, if you missed that first segment here, you need to go back and listen to it so you can catch up where we are. But we're talking about end-of-life decisions and choices and when you can make them and when you can't, and what prompts you to come into the hospice and the time frame. There's things that drive that. And one of the important ones was the 6 months termination, diagnosis of terminal illness, and your election not to continue with aggressive therapy. You want to, and that led to the bucket list we were talking about. You said list, but I know that movie, The Bucket List. Everybody's got something they want to do, and I was just talking about a friend of mine who passed away a couple years ago who followed that very path, and he said, because of hospice, he said, I was able to have the mobility and the functioning and the strength to do things I wanted to do to make sure my estate went where it was, and he said, somebody said, well, I'm really sorry. And he said, well, don't be sorry. I said, I'm lucky. I said, I have time. I've got time to do things I really wanted to do and put stuff in order, versus if I died of a heart attack, that would have been a heck of a mess for my family. And then people say, well, I think you would have wanted this, or I think you might have wanted that. Well, no, I can say exactly what I want on my terms and how I want to be. So that's important. And there's vets. We're talking about veterans, but this applies to anybody. Again, I don't care who you are out there, you're going to die. Hopefully you go and you sleep and you're 99.9 years old and life was good to you and gentle, and there you go. But unfortunately that's not the way it is in reality. And so if you get a chance to pick to go out as easy as you possibly can or on your terms, this is what hospice does.
Absolutely.
This is what hospice helps you do that.
Well, I think you've just explained an optimum hospice situation where we do work with someone, a patient, and their loved ones to provide the opportunity for them to have a bucket list and to complete the things on the bucket list. And I think that's what's unique about the team, because it includes the nurse, the social worker, the chaplain, volunteers, as I mentioned, and each of those folks are specially trained to be able to help the patient, the veteran, be able to accomplish those things. And I think you've just described just a great situation. And one that's optimum, and that's exactly because, just imagine the celebration that patient, as you mentioned, your friend who just said, I'm not sad, he had a celebration of his life. Can you imagine how his family and friends felt after he passed? A lot of peace of mind,
It was profound. He said, I'm not sad, I'm lucky.
You're lucky.
I'm lucky. He said, I had a chance to put everything the way I want it to be.
Absolutely.
Where I wanted my assets to go, what I wanted to set up for my grandkids. I had time to spend time with every one of them, quality time that I may not have done because I was so busy living life that, or not living because of the chemo was just not allowing me to. Right. And he said, and that's the hand you dealt. That's what it is. It's a lot of times you don't know what the clock is going to give you. You think you got forever, unless you're 99.9, then you figure it's all borrowed. That's all borrowed time. So whatever happens, happens. But that was it. And another thing in hospital I just wanted to bring up here too. You may have saw in the paper a year ago. We had a veteran. We didn't know he was a vet. There was a patient in hospice, and he was dying, and he had lived in over here in Hartford Terrace, as a matter of fact. And when he got his diagnosis and he was coming into hospice, he gave everything away. This young man was he's a Vietnam vet. He was an only child, and he had no children, no parents. His family's gone. He had nobody, no next of kin. So before he came into hospice, he gave all the stuff away. He said, the camera, this is what I did in my life, everything away, give me hospice. And so when it came to the end of life there, somebody said, well, what's going to happen to him? And one of the workers who went above and beyond, as far as I'm concerned, talked with him. And just in conversation, spending time with him, talking, found out he was a veteran and that he had served in Vietnam. Didn't want to talk much about it, but just said that. And then when he did pass away, that same individual said, this individual was a vet, but there was no next of kin, there was nobody to take care of the funeral. So Everest got him and the body, and they said, well, he didn't get the body. Today we have the situation where this vet passed away. Medical examiners got the body. There was no next of kin. It's going to be basically pauper's grave, but we know he's a vet. But we can't prove it. So I got online, did my thing. We got a copy of his discharge paper. He was a veteran. He had served in Vietnam with honor. And so I said, what can we do? He says, well, if you want to, we can go to the medical examiner and say, there is no next of kin, we'll take possession of the individual, and we'll make sure he's taken care of. So between Everest Funeral Home and the vet center, we did that, and we had the funeral for him over there, and the picture was in the paper, and it said, Kendra from the Chronicle took the picture, and there was 2 soldiers in uniform, because we got the Army, because he was Army, stood there, and he had his flag over his coffin, and the whole 3-4 rows in the front of the room there was empty chairs. There was nobody there, because he had nobody, but we were sitting behind him. And the Patriot Guard had come. They just came to the funeral because they always lined the thing, and they have never laid down the flags. They stood their flags up and come in and be a part of it, but there's nobody there. But they knew this was a fellow veteran. I didn't know him, they didn't know him, but he was one of us. So they put their flags all in the corner there, and they came inside the chapel and filled the chairs. And so we went through the whole thing, and then they folded the flag, and then they escorted him out. They gave the flag to me. They gave the flag to me, and I said, well, yeah, I'll certainly accept this, and if the next of kin should show up, there was none. I said I would, but I would be honored to have this, and I did. I still have it in my office. And then they put another flag over, and they put him inside the hearse, and there was glass on the side. You could see the coffin there with the American flag on it. They put these big Army stickers on the side, and they had American flags flying in the front, and then the Honor Guard, the Patriot Guard, got on the motorcycles. There was 4 in the front and about 8 in the back. And they escorted him out and back onto 31 and headed down towards Battle Creek. We were going to put him in National Cemetery.
What an honor.
She else think about it.
I know.
But you would think it was the President of the United States in there. I mean, and then he went down there. When they got to Battle Creek, more Patriot Guard, another 50 or 60. So this gentleman who would have died and been in a pauper's grave or just nothing, one person took the time to hear, not just listen, but to hear what was being said, and said, you know what? And so this man was buried with honors where he should have been in a national cemetery and stuff. So you guys are near and dear to my heart, what you do and make a difference. And it's a tough job. It's a tough job. But I think when you look at it like, you got time to do stuff.
Right.
And, you know, everybody's going to die. You don't want to, but you have the opportunity to go out with dignity. And go out with the choices being made and set stuff how you want it to be. And I think we all hope we have it that way.
Absolutely.
Well, I get most of it, let me go to sleep at night and I'll wake up in the morning and everything will be good. I don't know about it. Somebody else's problems. That's not fair. That's not fair to your family. That's not fair to those that love you. You have to look after them and whatever else. It's not fair. So, again, just kudos to what you guys do.
Well, I think it's a great example of how the hospice team, all of the hospice team, is trained to do that listening and the hearing, and to really connect those dots for patients, families, veterans, because it's so important for that to happen. And it's so important for someone that served our country to have that honor and to not just kind of die in the pauper's grave and be buried in a pauper's grave. And that's the kind of, even often reconciliation of families. They haven't spoken in years. Our team is trained to be able to work with the families and do some reconciliation before the end. So, I'm just so pleased that you've had such positive experiences with hospice, because I think it really, what you've talked about really exemplifies, what the core of hospice is. It's helping folks live peacefully and through the end of their life, and to be able to accomplish those things that they'd really like to do. And we don't tell them what that is. They are able to choose that. As you mentioned, with how happy this patient was, and your former friend, and his family, and just the fact that they probably had a lot of celebration when he passed away. But that's not often the case, and I just want to make those aware in Muskegon, Michigan, that we are currently in the process of opening a brand new healing center. It's going to be called the Bob and Merle Skolnick Healing Center, and this is going to be dedicated not only for hospice families, but for the entire community to grief and loss support. Individual counseling, there'll be support groups, we're going to be running ongoing children's groups, 10-week grief support, sessions in which you come in for really intensive group work, with a trained and certified bereavement counselor. And so we're very, very pleased to be working toward, hopefully in the fall of 2012, the opening of an actual center with those that maybe haven't had such a positive experience with death, maybe folks that actually don't even have an experience with death at all, but are experiencing losses like, not having a job and those kinds of things, can come and receive professional help and healing here at our new healing center.
Well, I look at, sometimes death is like a post-traumatic stress. It's a traumatic event that happened in your life, and you've got to deal with it.
Right.
The veterans who come back from war experience a lot of things over there, and they get this PTSD. You hear about it all the time, post-traumatic stress disorder, and that's war-related. But you can have PTSD from anything that's near-death experience, a rape, almost killed an automobile accident, or dying, or not having that loved one die, and I didn't get a chance. Exactly. I didn't get a chance to say what I was on my mind, or tell you goodbye, or we argued the morning before you left, and now you're gone, and I never had that. Or the separation. Why? And a perfect example is these men were hit by the automobile over in Wisconsin last week. I knew all of them. Many were vets, motorcycle riders, and the two guys are home already who didn't get hurt, and they don't understand why. And one young man said, why me? He said, I'm not married, I don't have any kids. These guys are married, they had children. Why did they get hit and I survived this? And I said, you need to talk to somebody.
Absolutely.
You need to exactly this, because that's a lot of vets went through that. Why did I come home and all these guys didn't come home? And at the end of life, and this is nothing we're seeing with the Vietnam vets who have post-traumatic stress, who never addressed it before ever. And then maybe at the end of life, they've got some other medical condition, maybe some dementia or a stroke or some other rationale that they're not keeping that in check anymore. All those years they've worked, they kept that little thing back here in the back.
Right.
And then finally it comes to the surface.
Easy.
And so as a healthcare provider, that's another thing you need to understand and or look at is this a veteran? Is this a combat vet?
Absolutely.
There may be some PTSD there because, Dave looks like a pretty nice guy here, and tonight when I go in and talk whatever else, he's down on the floor fighting a war someplace, and what is going on? Or because he can't keep that check anymore. They've never addressed that. And again, with veterans, a lot of them are in subsequent marriages that had PTSD. They understand what it was. The marriage broke up. And the kids were there, and I've had a lot of children come up to me that are adults now and understand what PTSD is. Said, now I know why my dad was the way he was. Well, Dad didn't even know why he was, nor did your mom. And then and then here's what goes. But there's that chance to come back together and say, okay, wasn't the best dad in the world, but there was some reason why. We have time to reconnect or to say sorry, whatever. I think that's pretty important to be able to do that, and you provide that. So, do you take another break? Okay, we're going to wind it up right here. We'll be back in just a few minutes. Don't go away. Get a cup of coffee. We're coming back.